This is my family, and we have a pretty much stereotypical perfect life, happy life. 2 kids, a dog, and a very happy marriage. But this wouldn't have been possible without Perinatal mental health service. The little girl you see here was miraculously conceived 4 months after we lost our son Charlie, our little baby. Then there were no smiling faces, and there was only 3 of us left, with very big challenges ahead. And we were so blessed to have the support of the Perinatal mental health service, and we had access to Kirsty and were offered as much support as we needed to get us through the time following the loss of Charlie. Thankfully, we didn't become another broken marriage statistic following infant loss, and having someone with the ability to use a variety of psychological models to help us through the horrific time meant we weren't solely responsible for getting ourselves out of the dark tunnel we just found ourselves shoved into. In our first few sessions, I don't think I made anything clear. I was sobbing, I was an absolute wreck and wanted to be admitted into hospital just so that I could feel safe and not a worry to anybody. But as it was, week by week we grew stronger. I dealt with anger, guilt, and also a weakening of my belief in God's protection for us as a family. And all of that was done through therapy. Our wonderful daughter, Ruby, was conceived in an attempt to patch up our family unit for Joshua and Craig. Naturally, I didn't want anyone other than Charlie at the time. I didn't want anyone to know that I was pregnant, and I couldn't face the delight on the faces of those who found out. And so we had a lot of work to do in 9 months. Imagine what I would have done if I hadn't had the support of the Perinatal mental health service. I was the mum, and what would have happened to us all if my mental state had not improved? What if our marriage had suffered? Without the support we received, there would have been no protection for us. There would have been no one to ensure all medical staff were aware of our loss. No one would have suggested an additional care time away from home after the birth of Ruby, and no one would have arranged a birth 2 weeks before the delivery date, because by some cruel coincidence, Ruby was due to be born on Charlie's first anniversary. So there would have been no one to confirm I wasn't clinically insane, and no one to show me that deep down I really did love my baby, Ruby, our new baby Ruby. And I knew on that terrific night, that the night we lost Charlie, that we needed help to get through the following years and to protect what we had as a family. The absence of Charlie is as much a part of us as the presence of Joshua and Ruby, and the Perinatal mental health service has helped us embrace this and move on in our lives. Ruby was a joy to us from the moment she was born, and a gift from Charlie and God to help us all heal. And thanks to people like you, I do believe in happy endings, and thank you so much for all you are doing to help families like ours.